Rabies is a viral disease that causes inflammation of the brain in humans and other mammals. The virus is commonly transmitted via saliva that contaminates bites, scratches, and wounds. Animal species that present the highest transmission risk to humans include canines, such as dogs, foxes, coyotes, cats, raccoons, and bats. In the Philippines, the main vectors are dogs and cats. The incubation period is the period from the time of exposure up to the appearance of the first clinical symptoms of rabies. It is extremely variable, ranging from 4 days to 7 years, but generally 20 to 90 days.
The prodromal period lasts for 10 days, with nonspecific manifestations such as fever, sore throat, anorexia, nausea and vomiting, generalized body malaise, headache, and abdominal pain. Paresthesia, or pain at the site of the bite, is due to the viral multiplication of the spinal ganglion just before it enters the brain.
Rabies exposure categories. For Category 1, this includes feeding or touching the animal, licking of intact skin, or other casual contact. For Category 2, this includes nibbling of uncovered skin, minor scratches or abrasions with no visible bleeding or can be induced to bleed. For Category 3, this includes transdermal bites, scratches, abrasions with spontaneous bleeding, or exposure to a rabies patient through bites. So what do we do? For Category 1, washing of exposed skin with soap and water would suffice, and vaccination or rabies immunoglobulin are not needed. For Category 2, still we need to wash exposed skin with soap and water, and this is where vaccination is advised. For Category 3, still washing of exposed skin with soap and water is advised. Vaccination is also recommended, but with the addition of giving rabies immunoglobulin to provide the immediate availability of neutralizing antibodies at the site of exposure.
The Department of Health continues to be committed to the fight against rabies and has set the goal for rabies elimination in 2020. In fact, Rabies Act of 2007 provides for pre-exposure immunization of children 5 to 14 years old living in areas with the highest incidence of rabies. If you're at risk, it is important that you and your pet get vaccinated. Remember, vaccines work!
Remember, vaccines work!
Remember, vaccines work!